I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we'll be providing our weekly COVID-19 data update. So to start out, all of this data is available on the dashboard, chi.gov/COVID-. We also will be posting all of these slides online, so you'll be able to take a closer look later. You see that our cases per day in Chicago remain in the substantial transmission range, currently averaging 362 per day. The rest of our metrics, test positivity, non-ICU beds, and ICU beds, all remain at the lower transmission risk. Chicago's currently at 3.8% positivity. There are 184 folks with COVID or suspected COVID in non-ICU beds across the city, and 59 people in ICU beds with COVID or suspected COVID. The Delta variant is very much here. This is just highlighting between May 8th and the end of July for the Midwest region. But across the Midwest, Illinois, Chicago, nationally, Delta is now accounting for almost all cases, estimated more than 90%. You can see in early May, most of the cases were that light orange. That was the Alpha variant. And by the end of July, really the estimate, most are that dark orange. That's the Delta variant. If we look at how we're doing nationally, obviously COVID is surging. The darker areas on this map show places where we are seeing more cases per 100,000. So nationally, across the whole country, the average is 33 diagnosed daily cases per 100,000 people. Here in Chicago, we're currently averaging 13 diagnoses per 100,000 people per day. Case rates are not the whole story, though. We are doing a lot of testing here in Chicago, which I'm pleased to see. We're averaging more than 11,000 COVID tests a day. That's part of what is keeping our percent positivity relatively low. The national average for percent positivity is 10.2%. Chicago, again, currently at 3.8%. And I want to highlight on this map, the darker blue represent counties where the positivity is over 20%. And there are even counties that are higher than that, over 30%. Literally 1 in 3 people testing is being diagnosed. This is part of why we look at both case rates and positivity as we're understanding surges of COVID. And where people are avoiding testing until they're ill enough to need medical care, we often see very high percent positivity, like what's being seen in the Southeast right now. Finally, hospitalizations. Again, we see that hospitalizations are surging in these less vaccinated parts of the country. Just to be clear about it, that darkest red, more than 80 hospitalized people per 100,000 in the Jacksonville area, for example, is higher than we ever had here in Chicago for COVID hospitalizations per populations. So nationally, across the whole country, the average is 20 hospitalized patients per 100,000 people per day. But that is highly concentrated in those hardest hit areas and nearly all in unvaccinated people. Chicago is currently averaging 9 hospitalized COVID patients per 100,000 people per day. Nearly all of those are unvaccinated, and that would include non-Chicago residents who are being transferred into Chicago for hospital care or higher levels of care here. If we look at the whole pandemic, we've been showing this graph really each week, and I want to highlight that at our 362 cases per day, we are back on the increase, but not seeing anything compared to what we saw with the first or second surge. Lots of attention on breakthrough infections, but we're actually at 99.7% of vaccinated Chicagoans have not been diagnosed with COVID since being vaccinated. Last week, it was at 99.8%. Similarly, where we look at hospitalizations for Chicago residents in the full pandemic, 99.99% still of vaccinated Chicagoans have not been hospitalized. And where we look at deaths, 99.999% of vaccinated Chicagoans have not died of COVID. Here's an individual hospital example in a place where COVID is surging, because it's not just here in Chicago that we're seeing vaccines really protect people, especially against hospitalization and death. This is just one hospital from Houston, Texas, an area that's being hit very hard. And in this hospital, you can see, as of just a couple days ago, they had 83 people hospitalized with COVID. 9 of those were unvaccinated. 9 of those were vaccinated. 74 were unvaccinated. They had 24 people in the ICU. All of them were unvaccinated. They had 10 on ventilators. All of them were unvaccinated. If you look at patterns of hospitals across Louisiana, across Texas, across Arkansas, Tennessee, this is the same pattern that we are seeing. In Chicago, unvaccinated people also remain much more likely to be diagnosed with, hospitalized with, or die from COVID than partially or fully vaccinated people. We're updating this each week. The red line shows the case rate for people here in Chicago who are unvaccinated. The dotted blue line are people who are partially vaccinated, meaning they've only had one of the either Pfizer or Moderna doses, and then the dark blue represents fully vaccinated people. And for cases, hospitalizations, and deaths, we are seeing it continue to land predominantly on unvaccinated people. If we look at our recent Chicago COVID data by age, we see here that the majority of cases continue to be among people in their 30s and their 40s, and the dark blue there represents 0 to 17-year-olds. We've been getting a lot of questions about kids. We've not seen a significant surge in cases and not a surge really at all in hospitalizations at this point for children. If we look at the last month in Chicago by race ethnicity, we've had about 7,000 COVID diagnoses over the last month, about 370 COVID hospitalizations, and fewer than 50 COVID deaths, which is a very good month where you look back over the whole COVID pandemic. But we are seeing racial and ethnic disparities. You can explore this further on the dashboard. But for example, 32 of those deaths are among Black Chicagoans, and again, predominantly unvaccinated. Where we look at that case rate by race ethnicity, similarly, in the top graph here, for example, the purple represents African American Chicagoans, and the highest risk of all is being vaccinated or not. At this point, that's a higher risk than race ethnicity. It's even a higher risk than age when we look at cases, hospitalizations, or death. I've shared this previously, but this is just showing how we're doing in terms of COVID vaccination. The shaded areas are on the left, that every zip code in Chicago, at least 40% of eligible Chicagoans over the age of 12 have had at least that first dose. We've got 6 zip codes, which have the star in the middle just to orient you, the ones that are not shaded in, that are between 40 and 50%, so have not yet crossed 50% vaccinated. And then on the right, we've still got 13 zip codes that are between 50 and 60%. So these are the areas where we're continuing to do the door-to-door work, the outreach work, lots of ongoing outreach here. But on the other end of the spectrum, we still have a ways to go. So on the left here, the areas shaded in blue, at least 70% of eligible Chicagoans have gotten a first dose. And that's, to me, a little bit of a floor. So I'm glad to see those areas getting to 70%. But let me tell you, I want to see those areas get to 80%. I want every area to move up by at least 10%, and we'd get there. You can see that really only right around the loop where population is very low do we have areas that are 80 or 90% vaccinated. We have seen a slight increase in vaccination rates over our past few weeks after a long decline. Just want folks to know 63% of doses are being given in pharmacies. You can walk into almost any pharmacy in Chicago, no insurance, no identification, no cost. You will not get a bill. And that's how many Chicagoans are getting vaccinated. After pharmacies, the next most likely place that people are getting vaccinated is with an outpatient doctor, which is good. So we're seeing that at federally qualified health centers, outpatient providers. We like people getting vaccinated in pharmacy and healthcare settings because they can ask questions and hopefully feel very confident about their decision to take the vaccine. Obviously, we continue to have a lot of pop-ups, and every week we're out all over the city, especially at places where people who may have more barriers to vaccination are, and we have our at-home program. When we look at our percent of Chicago residents vaccinated by age group, we did cross that 50% mark for the 12 to 17-year-olds in this past week. We were glad to see that, particularly as we're heading towards school. And we have seen the biggest increases recently in that 12 to 17-year-old group. So if you've got kids who are going back to school, now's the time. Please do get them vaccinated. It helps add another layer of safety to school. You can see that our most vaccinated population here in Chicago are people in their 50s and 60s. But unfortunately, we see it fall off a little bit again when you look at folks in their 70s and their 80s. So especially if you know somebody who's older, over 60 or especially over 80, not yet vaccinated, these are the folks at highest risk of all for severe outcomes. And if we look at race ethnicity, you'll see that still we're making progress. The majority of doses each week, all summer in Chicago, have gone to Black and Latinx Chicagoans. But still, we're at about 2/3 of Asian Chicagoans, about about 63% of white Chicagoans, about 51% of Latinx Chicagoans, and about 42% of Black Chicagoans of all ages have gotten at least that first dose. And we can look in some more detail if we break down by age, race, ethnicity, and gender. The most important thing is that really in the younger age groups, 18 to 29, we're especially seeing Black Chicagoans lagging for both men and women. Whereas if you look at the oldest group, over 65, we're seeing Latinx really lag more for both men and women. And so we're doing more focused outreach with that attention. And I encourage you, again, take a look at the dashboard. If you want to see your zip code, you can see what your vaccination rate is. You can see what your case rate is, your positivity rate. That's really getting updated Monday through Friday. So LALApalooza follow-up. I know there is a lot of interest in this, and we are, as of today, 14 days post the beginning of LALApalooza. And so in this setting, we wanted to share what we have seen. The bottom line is we've not seen anything that has surprised us related to this LALApalooza outbreak. But let me talk you through what we've been doing to follow up, and then I'll share the data. So as a reminder, Chicago's case investigators continue to reach out to interview every Chicago resident who is diagnosed with COVID-19 to document their exposures, to conduct contact tracing, to match to vaccination records. So we investigate every case, always, not just related to LALA, and other public health departments do the same thing across the United States. We then share information if we're seeing exposures in out of jurisdiction, where something like LALApalooza would be. We also developed a supplemental questionnaire for any cases that reported LALApalooza attendance. We knew there would be a lot of interest in this. And generally, where we have large events, we will do additional investigation. We put out a nationwide request for case reports from any other health department. We use standard, secure public health communications channels for that. And supplemental interviews of anybody who reported any attendance at LALApalooza are ongoing. We also work to follow emergency department data at Chicago's hospitals because we like emergency data. You can follow people who present with symptoms that could be COVID, even if they don't have a diagnosis. And it's a way to see, are we seeing any changes in what we call syndromic surveillance? We didn't see any changes in COVID-like illness patterns. And we also specifically every year for LALApalooza, we actually have a tag if people come to the emergency department associated with this event, because every year we see people come to the emergency department for substance use issues or, heat problems or dehydration. And this year we expanded that for 2 weeks post LALApalooza so that we could follow up any potential COVID. Did not see increases or additional cases coming in through the emergency department. We also followed Chicago's overall epidemiologic data. So, for example, I showed some of that age group and some of what we've been seeing in terms of Chicago breakdown. Have not seen anything different at the city level in terms of patterns that would suggest an impact from LALA. And then we obviously will continue to do further investigation as necessary, but I want to make sure everybody understands any person diagnosed with COVID-19 on or after attending LALApalooza is included in the analysis. So these cases may or may not have resulted from transmission at LALA itself. We've been very broad here. Anybody who is potentially associated, we want to investigate. So we're not saying that every one of these folks was infected at LALA. In fact, we expect they were not, but we take a very broad view because we want to understand the whole picture. So now 14 days post, as I said, we've had no unexpected findings at this point. There's no evidence at this point of a super spreader event, and there's no evidence of substantial impact to Chicago's COVID epidemiology. We estimate approximately 385,000 people attended LALA. Approximately 90% plus were vaccinated based on measures that were taken at the site. We used 88% vaccinated as a conservative estimate for our calculations. So in total, we estimate that among vaccinated LALApalooza attendees, 0.004% were diagnosed with COVID. That's 4 in 10,000 vaccinated attendees, or 127 attendees. Among unvaccinated attendees, we did, as expected, see a higher rate of COVID cases, but it was still low. Among unvaccinated LALApalooza attendees, we estimate 0.0016%, or 16 in 10,000 attendees, 76 6 unvaccinated attendees reporting tested positive. And as of yesterday, we had no hospitalizations or deaths reported. We do continue to follow up. I had told my team before Lollapalooza that we were expecting to see in the vicinity of 200 cases, just based on what we knew about our case rates and the fact that people tend to assume that their COVID exposure is at a large event like Lollapalooza, even if they've had a lot of other exposures. And we have, in fact, seen this total of 203 cases identified with attendance at Lala and symptom onset on or after attendance. 58 Chicago residents, 138 non-Chicago Illinois residents, and 7 out-of-state residents. And just to highlight again, this is also reflective of risk in likely where folks are also coming from and going to, if you're seeing different rates among Chicago and non-Chicago attendees. So nothing unexpected in terms of these numbers. The majority of our positive attendees were non-Chicago residents, 71% of them. The majority were under 30 years old, 79% of them. The majority were white, non-Latinx, 62% of them. And the majority had symptoms, 82% of them, although we did have some folks who were not symptomatic but were tested, and they are also included. Where we look at our Chicago cases, 58 of them at this point, really important to note, not just for Lala, but for everybody in Chicago, 13 of those cases, 22%, did report attending Lala on or after the day their symptoms began. This is a really important reminder. We need everybody in Chicago not to ignore symptoms, assume it's a summer cold, regardless of your vaccination status, because we know vaccines are not 100% protective. So we've been asking people to stay home and test. But, unfortunately, in this case, these are largely folks who were vaccinated and therefore assume they didn't have COVID, but we did have some folks attending with events, which is why we work to try to pair, if you think about other settings, symptom screening with vaccination. We also had 17% that specified other high-risk potential exposure locations during the time, including bars and out-of-state travel. We continue to do interviews for non-Chicago residents. Again, nothing unexpected here. No sign of a, quote, super spreader event, but clearly with hundreds of thousands of people attending Lollapalooza, we would expect to see some cases. This is the graph, just to give you a sense of when people who attended Lala were reporting having onset of symptoms, or if they didn't have symptoms, a positive test. July 29th through August 1st was the time of Lollapalooza. Blue represents Chicago residents, red represents non-Chicago residents. And so, not surprisingly, folks were attending Lollapalooza. We've not seen a lot of continued cases or late appearing cases coming after Lollapalooza, but we're continuing to do follow-up. Again, nothing really unexpected or out of the ordinary that we're seeing here. And there was a survey of attendees that was also done, looking at, for example, were people getting vaccinated in part to attend Lala? We saw younger attendees were more likely to say that attending Lollapalooza was an incentive for them to be vaccinated, which goes along with what we've seen with our Protect Chicago music series. We know attending events like this can be a good incentive for vaccination. We also asked, did the requirement that attendees show proof of vaccination or a negative test make you feel safer at Lollapalooza? 76% said yes, 11% said no, 13% said it didn't matter. And we've been really pleased to see other large music festivals around the country following our lead here. Just yesterday, you may have seen, for example, Summerfest up in Milwaukee, Bonnaroo down in Tennessee. Both announced that they were going to require proof of vaccination or recent negative COVID test. Pitchfork, that's going to be here in Chicago, announcing the same. And I'll tell you, at the time that we were hosting Lala, these events were not planning to have any checking of vaccination or COVID testing, and that was not something we were comfortable doing here in Chicago. Felt strongly that if we're pulling folks together, this needed to be part of the event. Obviously, also an outdoor event, an event that largely attracts younger people. So I think having some additional data, knowing that it is driving vaccination rates for younger people, and that generally it does make people feel, at least some people, more likely to attend, I think is helping to drive what I think is a best practice in this space. So just as we look ahead, COVID risk cannot be eliminated. We want to stay open as a city, but staying open also means being careful. It means first and foremost getting vaccinated. It means getting tested if you have any COVID symptoms, and for now, wearing a mask in indoor public places. So please now's the time to get vaccinated if you haven't had the chance yet. Vaccinating all age-eligible Chicago residents is absolutely the most important strategy to keep people out of the hospital, to save lives, and to get Chicago post-COVID. We are continuing our Protect Chicago music series, offering free tickets to concerts exclusively for vaccinated Chicagoans. We also are continuing with large events at this point. The Lollapalooza is not the only event that we have looked at, and we have consistently seen with outdoor events not signs of significant spread. We've also seen relatively high vaccination rates at events. And again, if folks are going to large events, please get vaccinated. It helps reduce the risk for everybody. To give you a sense, for example, last weekend at Market Days, we had our Protect Chicago vaccine ambassadors on site, just as they were doing at Lala, getting a sense and checking, what percentage of folks are vaccinated, seeing what's happening with testing, and we were seeing well over 95% vaccinated at that setting. And then there have been some of these events that have been providing some testing. There's interim results, small number, but we've been seeing really a minority of people, less than 2%, attending these events who test positive for SARS-CoV-2 or for COVID. So we continue to absolutely recommend that all festival and large event organizers require all attendees to be fully vaccinated against COVID or have a negative COVID test. We also are continuing to obviously recommend wearing the mask indoors right now, regardless of vaccination status, not forever, but while we get through this Delta surge. And if we do see numbers, if we do see one of those risk factors move into the higher risk category, we may move to do some more enforcement around that, but that's not right now. That may be something that we're seeing, potentially in the next week or two. And we continue to recommend that large events be held outdoors, particularly while any of our local epidemiologic measures are insubstantial or high risk. And that is something that's been studied, even with the Delta variant, though we see the risk of transmission go up a lot. Already we knew that the risk of being outside was so much lower than the risk of being inside, that it's one of the safest things for these kinds of events. So here's just a quick picture of our vaccine ambassadors promoting vaccine pride at Market Days. If you see them out and about, please sign up for a vaccine, or where we're providing vaccines on site, take advantage of it. It still is surprising to me. Almost every day I'm interacting with someone who isn't vaccinated, and I have a conversation with them, and a lot of times they actually agreed to get vaccinated. So keep talking about vaccine. If you are vaccinated, looking ahead for our Protect Chicago music series, the next one coming up is the Chosen Few DJs. That will be August 28th, Kennedy King College, 12 to 7 p.m. And then we've got Subelo as part of the Pilsen Fest, September 4th at Harrison Park. You can sign up for these events at chicago.gov/PCMS for Protect Chicago music series. Again, open only to fully vaccinated Chicagoans. So for Chosen Few DJs, the 14th would be your last day that you could get that J&J dose, for example, to be vaccinated. And just as a last reminder, we continue to have really good impact. I'm very pleased with our Protect Chicago at Home numbers. 54% of the folks signing up for Protect Chicago at Home vaccines are Black, and about a third are over 65. So we continue to really move resources into that program. So walk into a pharmacy, walk into a doctor's office, have a conversation if you have questions. Call 312-746-4835. We will answer your questions. We will figure out whatever barrier to vaccination you have, and we will bring vaccine free of charge to your house for up to 10 people with either Pfizer or Johnson & Johnson. Again, free of charge, no identification required, no insurance required. Please take the opportunity now to get vaccinated. And with that, I'm happy to take questions.
I have the mic here.
We're encouraging people to get vaccinated. There are some people who would like to see a booster vaccination. Is the city prepared to administer booster vaccinations? Is there enough medicine to go around?
Yep. So obviously, we've been watching the booster conversation very closely. It does look likely that we may have a booster recommendation shortly from the FDA plus the Advisory Committee on Immunization Practices, the ACIP, for a very specific group of people, people who have severe immunocompromising conditions. And this is, we'll see what the official guidance is, but there has been a number of studies looking at how well does the vaccine perform in people with different underlying conditions. And the vaccine performs beautifully in the huge majority of Americans, but in people who are severely immunocompromised, for example, after an organ transplant, or people who are undergoing chemotherapy, or who are on severe immune suppressing medications, not surprisingly, the goal of those medications and treatment is to suppress the immune system. And so we don't see the immune system, in some cases, learn the lesson as well about how to fight off COVID. And so there were some studies where they looked at giving a third dose of either Pfizer or Moderna to folks in some of these categories, and a good number of them had a good response. And so I do expect that we will probably see that coming fairly soon. We are absolutely ready. We have vaccine available, especially because if this recommendation comes through, it would be for probably 2 to 3% of eligible Chicagoans, where we think about even at an outside, kind of the outside estimate of who this might include. This would be given through provider offices. So this would be through, your specialist, because anybody with this level of severe immunocompromise would be seeing a specialist for that. And so we certainly are ready with that. And even, if there are recommendations for other boosters down the line, which to be clear, there are not right now because the vaccine continues to perform very well, we've also done a lot of planning around that and are ready.
Carla Leal with Telemundo Chicago. Good morning. These additional steps that were taken during Lollapalooza, like the survey and so on and so forth, are they going to be taken with other festivals in the city? We're seeing Rideau Fest is around the corner. We also have the Bud Billiken Parade. I mean, there's all these festivals and events that are massive, and they are at some of the communities that are at higher risk. So what are your recommendations for the organizers of these events, and what measures are being taken?
Great question. So to take sort of the follow-up piece first. So like I started out just reminding everybody, we investigate every single case of COVID that is diagnosed in the city. And there's a series of questions that we go through whenever we're getting a signal for anything. If we're getting a signal for attending an event, if we're getting a signal for a particular location, meaning, more than one case, for example, we then do additional, that's some of what our epidemiologists do behind the scene. And it's not unusual for us to create a follow-up survey and go back and do additional questions around an event or really any kind of outbreak where we're seeing a large cluster. We do extra investigations into those as well. So where you're talking about parades or you're talking about festivals that are in the public way, there is not the full ability to, they're not a paid event and you're not able to completely block who is coming through. However, that's part of why, for example, like at Market Days last week, which is in the public way, our vaccine ambassadors, they're still there. They're still sort of asking, can I, do you have a vaccine card, and giving people stickers, proud to be vaccinated, I'm vaccinated. And we've been doing a lot of work with businesses that surround these events, because really I'm more concerned about the risks at the celebrations and the parties that may surround them that are indoors. And so trying to, encourage bars or others to look for proof of vaccination or recent tests when they're coming in. And then the other thing is we look at how many people are at an event and the ability to space and then potentially if folks are unvaccinated, to be able to mask as well. So as I said, we've not canceled any events, but we've been in conversations for the Bud Billiken Parade. There's going to be vaccination available on site. There's going to be a testing location where folks are wanting to get tested. Our vaccine ambassadors, my understanding, are in the parade with QR codes that people can scan and sign up for a vaccine if they don't want to get it on site. And we'll be doing all the follow-up just as we do for other events.
Hi there, Mayor with ABC7. Do you think Lolla was successful because it was outdoors? And with that said, do upcoming events like at the McCormick Place that are indoors, are those still safe to happen?
Yeah, so it's a good question. It's something that the reason why we felt comfortable moving ahead with Lollapalooza were for a number of things. First and foremost, that more than 90% of those folks were vaccinated. And that is, if we were more than 90% vaccinated as a city, as a country, we would probably be done with COVID, just to be clear about that. But that's the most important thing to me, where you can look for this vaccination or testing status. And that's why we worked with Lala to say, even if this isn't the standard in the industry, this is something we want to do here in Chicago. But paired with that is the outdoor event. There had been studies that, prior to Delta, to be fair, that had shown 16, 17 times the risk of COVID inside versus outdoors. And so if you think about the Delta variant being potentially twice as contagious, maybe there is some more risk there outdoors. I don't want to imply there's absolutely no risk, but still the risk difference is so different that having something out of doors is definitely safer. And the other thing, here in Chicago, summer is when we can be out of doors. And so the more we can try to gather and be out of doors during the time that we can, that's another part of our wanting to be open. I think the other thing is that we're not having a major COVID surge here. If this were if we were in New Orleans, Louisiana, I don't think we would have been able to move ahead with this event. And you saw that they canceled Jazz Fest, and I think that's the right decision, because when you are having a massive surge, the risk is just too high that there are going to be a lot of people with COVID. But when we're sitting at a moderate risk level and still in a generally controlled setting, that's some of what we're looking at. And then finally, that most of these attendees are young. So, we know that most of the folks who attend, and then again, most of the folks who got COVID, are really in that under 30 and many in the under 20 age group. If this were a large indoor gathering when our case rates were really high and it brought a lot of, 70 and 80-year-olds, that could be a different story in the future. My hope is we can get really vaccinated as a city. We can keep our case rates relatively controlled, because if we can keep our case rates relatively controlled, the risk, to the whole city is lower. I can't completely predict, of course, what the future will hold. I'm confident with the Delta variant, based on what we're seeing internationally and across the country, we're going to see this increase that we're on right now. Doesn't surprise me at all. But you saw that we're not seeing the major increases in the hospitalizations and the deaths. Those are going to go up too. But nothing, I don't anticipate seeing anything like what we saw prior to a vaccine being available, and where we're not overwhelming our healthcare system, and where we remain in reasonably good control, and there's a vaccine that's widely available. Our goal is to really try to stay open, and part of that mask recommendation for indoors right now is to get us through that surge. So we'll see what the future holds. I'm a little worried about the fall and the winter, where we would expect to see a surge anyway, because we know respiratory viruses, flu, other respiratories, tend to surge in the fall and winter. I think with Delta, this just came a little earlier than we had expected.
But for now, any indoor events are still
yes. For now, we are not recommending closing or not holding any events in Chicago at this point, indoor or outdoor. As always, we continue to obviously do the work, do the investigations, but that's where we are. That's where we are, and I think you're likely to see more of the requiring the proof of vaccination or negative test, which obviously we've been encouraging gatherings to do or festivals to do. But then also we've started to see a lot of businesses in Chicago also make that recommendation. We're in full support of that because it is the thing that helps make settings as safe as they can be, especially during a surge.
Dr. Ari Stefano, Esposito with the Sun-Times. Any thoughts on this Mayo Clinic study that shows that the Pfizer vaccine is only 42% effective versus the Moderna one?
Yeah, so I was on a national call the other day, and we were all looking at sort of all of this different data that's emerging, and obviously the conversation about should a booster be needed, when could that be, and to which population? So I think we've seen a wide range of studies. We've seen some that have shown everything has shown very good protection against severe outcomes, against hospitalizations and deaths. But we have seen some more of these breakthrough infections. And there's a question nationally. There's a question of really the reason we had to do such aggressive measures as a society really around COVID was because of how severe it is in a lot of ways, right? Like way worse than influenza in terms of hospitalizations, deaths, et cetera. And while people remain unvaccinated, or if we get a variant that emerges that the vaccine is not protective against, all bets are off. I think, the decision to move ahead with, or to likely move ahead with that booster for the immunocompromised, I do think is the right decision based on what I've seen. And we may see additional recommendations coming down the line. But I don't want folks to take that as I should go and get a booster shot right now, because the studies are very much ongoing, and we'll have some additional data that will be, there's the Mayo study, but there's the NIH study. There's a lot of things that are coming out, and no recommendation at this point. But yeah, it's some of what we're looking at.
We got a question in the back.
Good morning, Dr.
Good morning.
Araceli Gomez-Aldana from WBEZ. Looking at other summer activities like summer camps for children, block parties, other things like that, does the data show any type of surge or uptick in cases there?
So, from the very, very beginning of the COVID pandemic, CDPH decided of all the things to focus on, we wanted to focus on youth settings. We've had a focused youth team from almost day one here, just knowing that questions around kids, even before a vaccine was available, were probably going to be some of the hardest questions that we had to deal with. And so even last summer, we were investigating, and we made reportable, even individual cases in daycare settings and camps and all the settings where kids were last summer. And then, we've continued with that this summer. And what we've seen is that where we have the mitigation guidance in place, like we had before a vaccine was available, we very rarely see outbreaks, and we don't see this driving large surges in terms of COVID cases. So there certainly have been a couple of individual settings, a day camp or a daycare, for example, where you'll see a cluster, but nothing sort of at a population level, or nothing that has made us need to change recommendations around that. We have felt very strongly about recommending in-person education, even all of last year. And that was based on data from right here in Chicago and across the country that really showed that children could be in person, in school, and with the mitigation measures in place, keep that risk from COVID really relatively low. And with vaccine layered on top, I remain really confident. With After School Matters and some of these other things, we've done some additional outreach and looking at cases. We've also done some things with making sure vaccine could be available, with parents giving permission slips, looking ahead to school a little bit. But I feel confident about where we are with kids. And I expect sort of on my Facebook Lives over the next few weeks, we will keep a big focus on kids because I know parents have a lot of questions, especially as we're heading back into the school year. And a lot of places around the country are going back to school already. So we'll have some opportunity to see what that looks like, recognizing that there are a lot of places in the country that are not in very good control compared to here, but it still gives us an opportunity to learn.
Thank you. And then also recommendations for residents who are seeing, maybe going to a clinic and getting or potentially getting charged for tests or vaccines. I've seen that now that we're kind of, over the hump a little bit. What are your recommendations there?
So you are not allowed to get a bill for a vaccine. And there is a fund that was set up at the federal level for anybody who is uninsured, et cetera, where a provider can request that. The only setting in which someone could see a bill related to vaccine is if they got that vaccine as part of another visit. So if they were seeing their primary care provider and they were getting a physical and they were getting their hypertension managed, et cetera, and they happened to get a vaccine, you would see the same insurance billing that you would for any other setting. But nobody should be getting billed for COVID vaccines. And we've actually done follow-up. If there is anyone who is getting a bill for COVID vaccines that isn't appropriate, please let CDPH know, because we have worked to educate hard and follow up and ensure that, especially early on where there was some confusion about this, ensure that places had paid Chicagoans back even. So please, if there's anyone out there getting a bill for vaccine, especially if you got it outside of a setting in which you were also getting other medical conditions treated, do let us know. Testing, however, it is legal to get a bill for testing, to be clear about that. And most insurance companies have said, so for anybody who is symptomatic, right, there generally is not, there's not a bill, and insurances cover it. And we worked here with insurances in Illinois to make sure that that would be widely covered. But I think as we're seeing more people testing routinely in work settings and others, there is additional, we're looking at lots of different ways about how to make sure that testing could be supported in a way that does not land on individuals. And there remain many places where you can get tested without cost. But I would ask people to, if you're concerned about that, ask about that up front, because just as there's a pool of funding for uninsured Americans to get vaccinated, there's a pool for uninsured Americans to get tested too, but people need to be using that. So if you go to chi.gov/COVID test, you'll see more about where testing is available in Chicago, more information related to costs. And I do want to remind people that you can get these over-the-counter COVID tests, antigen tests. Binax Now is one of the companies, but there's others. You can get them at CVS, Walgreens, Walmart, Target, et cetera. You can order them through DoorDash even. It's 2 tests. It's about $24 for 2 tests, and they're rapid tests. You get the result in about 15 minutes, and you can do it yourself. So I keep some of these at home in case I am feeling the least bit under the weather. I'll just test myself, and that can be a relatively low cost for people to have access to vaccine, even separate and outside the medical system.
Any other questions?
Dr. Arodi, Jesse Gersh from Channel 7. So going back to Lollapalooza, you said the majority of the people who got sick were under 30 years old. That's a group that we've seen the number of cases of COVID in the city continuing to spike, and also at the same time their vaccination rate is not spiking. With what you've seen post Lollapalooza so far, and looking at that data, and just as we continue to move closer to fall, are we in any different mindset right now in the city in terms of possible vaccine mandates for restaurants and bars, et cetera? Because those are the same kinds of places that we'd expect that younger crowd to be attending.
Yeah. So you're right that in all cases, right, I've tried to make this point very clear, the biggest risk, no matter your age, no matter your neighborhood, no matter your race, no matter anything, your biggest risk at this point is being unvaccinated. We're happy to basically have hit that just about that 60% mark for that 18 to 29-year-old group, having gotten a first dose, where you look at all comers across the city, but that's not equal, especially where you look by race, ethnicity, or neighborhood. We at this point are not seriously entertaining the consideration for sort of a city-wide, meaning, we're requiring restaurants to vaccinate, anything like that. We are watching around the country, particularly in places where there are significant surges. I mean, you look at New York, for example, that was really the first to say they are going to mandate it in that setting. We may see some of this out of, New Orleans even potentially, or other places just where rates are so high that having a vaccine, or potentially a vaccine or a negative test, may be something that we see required. And so I'm not taking off the table that might be something we could consider in the future. But right now, really, we're trying to keep the focus on getting folks vaccinated. We've been really pleased to see employers make that decision to mandate vaccination, or in some case vaccination or frequent negative testing for their employees. We think that's a best practice, and certainly one that we're looking at closely here at the city as well. And I've also been thrilled to see many high-risk settings, whether that's bars, whether that's clubs, whether that's events, make that decision to require proof of vaccination or negative test to come in. We think that is also a best practice where people want to put that in place, and we've been trying to support businesses who are doing that. I think there's still a ways to go on some of the tech piece. The state has been working to make sure that the state registry, for example, individuals are able to access that in a way that is private and secure, because we know that, the physical card can be hard, and, as this may become part of what we all do, right? I mean, I wouldn't be surprised. Already, you basically need to be vaccinated to travel internationally. Might we see down the line needing to be vaccinated to get on an airplane? We might. And so working to try to think about what is the the tech piece that goes with that, to be able to put that in place is something we've been really thinking about and working on. But right now, really encouraging employers and settings to make that decision for their own setting. No plan at this point for a city requirement around that.
Also on Lollapalooza, you mentioned this is 14 days after the first day. It's obviously a 4-day festival.
Yeah.
When can Chicagoans feel confident that we would truly be out of the woods in terms of any damage that would have been done has come to fruition? You mentioned those case rates or those case numbers that were up there were estimates at this point. So does that mean you're waiting for more positives?
Yeah, I expect we may see some more positives come in. Not new people being diagnosed at this point, most likely, although we will follow, as you know, another 3 days. But we knew there was a lot of interest in this, so wanted to come out. We may get some other case reports in from out of jurisdiction. I wouldn't be surprised, as we've sent and really put out the call. Let us know, is there anybody who was related to Lala? We would have seen a surge if we were going to see a surge at this point, by my estimation. And again, this is basically what I expected to see with deciding to move ahead with Lala. We can continue to provide updates as our team works on, continuing the follow-up and the investigations. We know there's major interest in this, but I don't anticipate. I want to make sure we finish getting all the data, but at this point, I don't anticipate seeing anything that suggests this was a major super spreader event, for example.
And just to clarify, because you said estimate 100. I believe it was 150. So there's 76 unvaccinated people and 100.
Yeah.
I apologize, I don't remember exact
That's
number.
okay.
But
Yeah.
those two numbers, are those confirmed? You said estimate, but it didn't say estimate. Could you just clarify what you mean by estimate?
Yeah, of course. Yeah. So those are cases. Those are people who were diagnosed with COVID, who were at Lollapalooza. We're not 100% that they were necessarily that's where they got it, but they were at Lollapalooza. The estimate I was referring to was that we made estimates around the percentage that were vaccinated, for example, and then used that to calculate that percentage, right? That 0.0004% of vaccinated attendees to Lala were subsequently diagnosed with COVID. So that was where the estimate is, but those numbers are individual cases, and we're working to do the supplemental questionnaires and the follow-up on all of them. Yep.
One more? Yeah.
Just to follow up on the question, so the city is considering some kind of vaccination passport program going forward?
We're not seriously considering that at this time. What we're doing is looking around the country to see how this is playing out. I'm very interested in some of this tech work to make sure that no matter what setting, if an employer decides that they want to check vaccination status, et cetera, we'd like to think about how to make that be more possible. But we are not seriously considering at this point a vaccination passport per se, as people use that term.
Okay, thanks everybody.
Thank you.